Good morning. So, before I talk about the program I'm in, I want to introduce you to me. My name is Jason. I was born in July 1984 in Miami, Florida. Now, I was born with a disease called three-allergy-a-phthalate. What three-allergy-a-phthalate is when all four of your chambers are affected. So, they had to put me in an incubator. All right, incubator to breathe because I couldn't breathe. So, through the years, I've had 9 heart surgeries. I have 4 tissue valves made of pig and a mechanical valve. I have a pacemaker slash defibrillator, and I take meds. Now, I've had strokes and I've had seizures. And then last year, my life shattered because my mom passed away with cancer because she was misdiagnosed and she didn't get the proper treatment that she needed. So I wanted to do something to either work from home or get me into a program that is going to help me be able to save money so I can help women and men be able to get tests or they're able to get like exams, medications, and all that for cancer. It is not easy, all right? Cancer is a disease that can kill you very quick if you don't get it in the beginning. You can go from stage 1 all the way to stage 4. I mean, my mother fought so hard and she lived a healthy life. Now, that's the reason I got into the program called Ameriplan. And the reason is good to get in Ameriplan either if you want to work for it or you need affordable health coverage. Now, a lot of people has lost their job and their insurance was from their job. No work, no insurance. So now you have to pay higher costs to go see your PCP, higher costs to go see a specialist, or if you need vision or dental. So depends on what health insurance you have. All right, you can go paying from $50 to almost $200 just to see a PCP. Now, with our insurance is double than that. So you can go from 50, just say you paying out of pocket, you could go paying $150, $200, depends on how much a PCP charges for somebody who has no health insurance. Medications depends on medications because um if you're a person who has arthritis, osteoarthritis like my father does, he has to get a shot and he has to put it in his, I think his knee or his hip. But that meds is $300. No insurance, you could look at almost $1,000. Everything that has to do with the medical field, if you're not insured, you're gonna pay a lot of money. And then it depends on the person that signed you up. What plan did they put you in? Most of the time, you're paying more out of pocket. Now, with a Ameriplan started in 1992. And they wanted to help people who don't have health insurance or they do have health insurance, but they're paying way too much. So you're able to spend to get in, it's $40, and then you pay $20 every month. Now, What does it cover? It covers everybody in your household. So if you got a roommate or you got a person who lives on the side of your house, anybody's in your household gets covered no matter what age they are. From all the way from infant to your senior citizen. We give you coverage for dental, PCP, specialists, medicine. Medicine, they got up to 15,000 um, prescription prescribers that will basically help you with your meds. So me, because I'm on Medicaid, I don't pay for my meds. But if I had to, I'm looking at between $75 to $100 just for my meds, and I take back 10. I take, what is it? Coumadin is a blood thinner. I take Ameriplan, that is basically for palpitations. I take furosemide, Bumex, that's for water. I got other meds. I mean, most of it's for water, most of it's for my heart. And then if I wanted to go see a PCP and I'm not insured, I'm looking at 150 to maybe $200 unless I need to go to Miami Jackson Memorial Hospital, and I'm looking at $500 if I'm not insured. Lucky enough that I got insurance by disability, and I'm covered, and especially I got long-term care now. So right now with the whole COVID-19, this is the time you need to be insured. This is the time that if you go to the hospital, you want to have affordable coverage, or you need to have health insurance. Or if you don't want to go into a Ameriplan, or you don't get into a Medicaid or a Medicare, you can actually ask the person who's asking for your insurance if they can give you government insurance. Now, with government insurance, you can only be covered by your own county. Can't go to another county. It has to be where you're living at. And that's the health insurance that they give you. And that's the price you're going to be paying for medication, for your dental, for any stuff like that, government insurance. Um, it depends too on what part of Medicare and Medicaid you're in, because some of the plans have copays, some have a lot, some have less. Depends on the person that signs you up. Now, if you're paying way too much, you really need to get in my inbox. 772-301-8844. I could show you and send you the website for Ameriplan and what are the coverages of what you get. I mean, it's a it's a great program. I mean, they're BBB with the Business Bureau. They go by the guidelines of the HIPAA law. They will give you affordable health care. Now, if you cannot see a doctor in person, you'll be able to talk to a doctor virtually, like a Skype or a Facebook Messenger or FaceTime, and the doctor will basically just talk to you about your situation and what he can do to help you in. But come on, people, man, this is seriously the time that you need health insurance. If you're a person who has asthma, if you're a person who has diabetes, if you're a person who got heart problems, if you're a person who got cancer, if you're a person who has dialysis, if you're a person who takes medication for any reason, you need this. There's no ifs and buts, all right? If you're not able to buy your medications, I'm sorry, you're gonna die. Seriously. If I'm not covered by disability with my insurance, and I don't pick a plan, I don't get with Ameriplan, or I can't get into no health insurance, I will die. You need medications. If you're a person who's not sick but you got sick because of the coronavirus, there's going to be side effects from the coronavirus, and you need to be covered. So, reason I got into this is because I have health problems, but I want to help other people be able to pay for anything they need or anything they need to get their child, or if their child's sick or you're sick. Not wait for the last minute. Oh, I have no health insurance. I can't get my meds. What am I going to do now? Gotta think. You gotta have a plan B. If your plan A was your job and your job went out of business, what's gonna happen? You lose your coverage. You're not covered by your company no more because your company went out of business. So you got into what is it? Unemployment, and yeah, that 1,200 stimulus check came in. But guess what? Where's your source of income to pay for your medications or to see a primary doctor if you need to see one, or a specialist, or you're going through issues or you need meds for your dialysis? Where are you gonna get it from? Think, people. You need to get in my inbox. There's yo, this coronavirus is not gonna go anywhere. Even if there's riots or anything, it's gonna keep circling and circling. Why? Because more people lands in the hospital, and that's where you seriously get more sick in the hospital than what you came in for. I know this. I spent 35 years in the hospital. I know everything has to do with the hospital. But your life matters. This is the situation you need health coverage. So if you're paying too much, get in my inbox. If you don't have insurance, get in my inbox. If you need to call me, 772-301-8844. Now, if you need work from home program, do you get paid $100 an hour or more? Get in my inbox. Me and my team will work with you and give you a great program called Ameriplan. And if you need to do your research on Ameriplan, ask me and I'll send you every information you need. But my name is Jason Llano. Yo hablo español también. So, toda mi gente que no tiene seguro, llámame. Que tiene seguro pero está pagando mucho, llámame. Esto es el momento porque este coronavirus no sabe cuándo va a terminar. Y tú puedes coger otra cosa con esto. So, no crees que porque esto se terminó que tú no puedes coger una enfermedad. Porque esto que va a pasar. Alright, llámame 772-301-8844. Ten un buen día. I love you all, people, and hit me up.